Yo quiero mencionar algo muy importante. Para personas inmigrantes, está bien que hablemos inglés, ¿verdad? Pero no saben lo difícil que es, porque no fue fácil aprender inglés como las personas que nacieron en Estados Unidos. Para mí es un gran reto tener estas presentaciones en inglés. I am a Latina. I'm proud to be a Latina, and my first language is Spanish. I feel more comfortable speaking Spanish, but if I'm speaking English, it's because I try to other people helping our community. I'm becoming HIV positive when I'm moving from New York to Florida. When I want to leave the escorting services and have a new life in Florida, and I'm start a business there. And then I'm apply for insurance, and then the insurance deny me, life insurance deny me, and I say why, and they told me you test coming positive, and that's words mark my entire life. I hate my status with my family, specifically with my mother, because she loved me so much. And when I really have the strength to tell to my mother, I tell her to my mother I want to say something about my status, and she say, I know you are HIV positive. And then what made me cry and made me so vulnerable, because she find my medications long time ago, like 5 years or 3 years or 4 years before I decided to. And she live with that inside and don't show me more love, you know. Some families, when they find their status, they separate place or they don't to allow, but she was so care with me and love me a lot. So I feel bad and not disclose my status with my family in the beginning. But now she's my best resource. She helped me a lot. My family, they are very proud about me and my status. And they know it's not easy disclose the status, but it's part of my life and part of my mission in this life. I working in the health department for many years, and I see they have some regulation where it's not friendly for the transgender community, you know. And then I'm start working, helping the transgender, organizing the transgender in that clinic, and see what is the needs. And then I learn a lot. So I'm a step out, and I try to open my organization when those kind of things specific for the transgender community, for my community. And I'm so proud now to say when somebody wants to work for the transgender community or with the transgender community in South Florida area, we are the first resource. Any transgender who they coming in Florida, we connecting with them, we give the resources, and we trying to give the best life or the best quality of life who any person they have to deserve. If we thinking about Miami and Fort Lauderdale, they are the first and the second place in new infections in HIV nationwide, and that statistics or that numbers, they never change. And also we identify 3 bigger issues in South Florida area, what the most impact for the transgender community. The first one is employment. You don't see in supermarkets, you don't see in pharmacies, you don't see in TV channels or media a lot of transgender people working. Second one is housing. You know, you cannot waiting to get the proper care or getting adherence and medications. I don't have place to live. So transgender in South Florida every day fight to have a better place to live or decent place to live. And the third issue is medical related, like adherence with HIV, but also hormone replace therapy and prevention or PrEP for transgender individuals. So that is the major 3 issues we have. For other communities, it's so difficult to get mental health. Imagine for the transgender community, when many of us, we are uninsured. Many of us, they have to have services, public services, when they are no cultural competence or they don't know they don't have correct training to us. So imagine me going to one medical doctor to concerning about my health, and see people who working over there laughing on me and think my health is ridiculous or I'm the clown. I cannot go to the mental health or any medical provider if they take me like that. Imagine if the transgender have the opportunity to have insurance, or many we don't have it, but I have insurance. But my insurance don't cover my health. Sometimes they are friendly when the HIV medications, they are not friendly for the transitionings or for the transgender health. And sometimes they are covered some transgender health, but they are not friendly when the HIV. So it's very important get the appropriate care for transgender individuals in the medical and specific and mental health and rehab programs. As soon as I open my organization, I feel the discrimination of the gay and lesbian community, actually. And I feel more approach for the straight community. And we're feeling more working with the straight community. Actually, my organization works with the National Reproductive Justice, and other organizations who they are helping all women, and I think they are more accessible for us and they're more inclusive. But I think gay and lesbian community, they think the only place we have to be is in the stage, you know? They don't look at us like we can be a lawyer, doctors, or have other type of employments. You know, for us, just we have to be in one stage and singer for your life. Well, I am immigrant for myself, you know, and the quality of life I have right now in the United States is what I wish for my old sister, trans-Latina. Right now, we have a community. We are networking together. We have amazing organizations or groups like Positively Trans-Latina Coalition, who they are led by trans-led persons who they know our needs, our real needs. We are a sisterhood, and more of the community, we are a family together.